Welcome, everybody. And today we're going to be talking about cybersecurity, which is a very complicated subject. There is a lot to know in order to truly protect your organization, especially when you're handling such sensitive information as healthcare information. So to discuss this, we have Jorge Mastrapa with us, and he is a global executive with extensive experience expanding operations, managing new programs and projects, improving performance, increasing customer satisfaction, and reducing operational cost. He has his MBA and his Ph.D. With a focus on international business, organizational development, and strategic business analysis. He has an executive track record of accomplishments in the global telecommunications, supply chain, and IT consultation industries. He's fluent in English, Spanish, and Portuguese, and he currently is the co-founder of CySeSo, which was founded with the objective of helping protect companies and to provide a one-stop solution for all of their cybersecurity needs. In order to accomplish that, his company has successfully partnered with the leading companies in the field of internet security to bring companies the most effective solutions to the security challenges that they face today, which are continually growing, and it's like a moving target. From malware and ransomware protection and regulatory audit support to disaster recovery and cyber insurance. So you cover the gamut of what healthcare organizations need in terms of cybersecurity. It's a major topic. Healthcare information is a huge target because it's worth more than even, just identity theft or financial data. So can you explain, why is healthcare such a target and what are the threats out there?
No, Raymond, thank you for inviting me. And it's a pleasure to be here with you and the rest of the team. Speaking very clearly and going directly to the point and the question you asked, why is patient information so important? Well, there's two main reasons why hackers and internet predators and criminals are looking for health information. And by the way, this is not one of the primary targets just in the US. This is one of the primary targets on a worldwide basis. And why is this? Is because it touches two of the main components that criminals like to target. One is financial information, because as healthcare providers, companies that are in that industry normally have an extensive amount of paying information or payment information from both the end user, the clients, the patients, as well as from contacts from bank and paying companies, the insurance companies. So by targeting healthcare companies, hackers can automatically get access to all 3 points of a financial attack: the end user information, the billing company, and the company that pays. So they could actually try to get into any one of the 3 points and either using end user information to submit a false billing report or faking their position as a payment company at the end. They could actually steal even more information and commit financial crimes. That is number one. But in addition, we need to remember that for many people, and I count myself between them, our private health, our health information is very private. It's something that we guard. It's something that we and our families, would not like to be out there simply because it's a private information. What medicines we take, what treatments we might be under, all that can be influenced by access to your private information, and that's what they targeted. And because this information is related to the life of a person, it is not something that expires that tomorrow or something that they need to use in the next 3 days. If they can get access to your, for example, to your healthcare ID or to your payer information, they could use that one, years down the road, and you still be subject to that. It is not like a credit card that you can cancel. Canceling your Medicaid ID, it is probably a lot complex and more costly to everybody involved in the process.
Yeah, yeah, and one of the struggles we have with healthcare information is it's like there's two things that are really important. One is being able to share healthcare information. So usually when you have something super private, like a secret, right, you're just going to lock it in a cabinet where no one's ever going to have access to it. So it provides great security. But with healthcare, we need to be able to share healthcare information for good care coordination to get the most accurate diagnosis and treatment plan, et cetera. So yeah, we want to be able to share it, but then at the same time, really secure it very well. And I know that's something that HIPAA law struggles with. And that's one thing that you assist with is compliance with, laws around the security and privacy of healthcare information. Is that right?
That is correct. One of the main challenges that many providers on the healthcare industry are facing is that it is a highly regulated industry. And as you mentioned, HIPAA, it has been, in this US, has been created to protect that information, but at the same time to allow patients, service providers, and everybody else on the ecosystem to be able to exchange information on an as-needed basis. The challenge that you will find is that there are two issues with this one. One, we have to facilitate companies from being able to provide the data, but at the same time, we need to be able to protect it. And in many cases, I'm not even talking about what a hacker might do stealing your information. I'm simply talking about mistakes that we all can see. And I have personally received in several occasions, either emails or faxes. Will you remember faxes? Well, some companies do those.
A lot.
Yeah. And I have received personally, I have no idea, I have received faxes with patient information sent to my company. Maybe because I'm in contact list because I'm related and we're providing services. And I've done the right thing in which I have destroyed the information, but look at who sent it and send back to them something saying, please, I confirm that I received this one, that I have deleted it, but please, verify that you sent it to the right person. So we all in the chain of events that are related to transfer and custodial of medical related information, we need to be aware that mistakes might happen. And that's one of the reasons why HIPAA is so careful and why people need to be so aware of their need to protect both on a proactive basis regarding being able to implement measures and let employees and partners and everybody involved in the chain to understand how to protect the information, as well as on a passive basis, implementing IT measures that will help companies protect that information even when a mistake might be done. And that's what we normally call on the industry data leak. When persons are, sometimes unaware of it, leaking information that should not be done. And that's one of the areas where most of the breaches happen without companies even realizing.
Yeah, yeah. And so how is it that your company assists healthcare organizations with HIPAA compliance?
We assist healthcare organizations with HIPAA compliance pretty much from an end-to-end basis. We help companies identify, first doing an assessment of their current HIPAA posture. We help them develop or update their HIPAA compliance regulations. We help companies train and track the employees, both the existing one as well as new ones, as well as we help companies develop, implement, and monitor HIPAA compliance across the company. And in the case of as many companies are going right now, going to the cloud, we help them understand also the dangers that have in regards to going to the cloud and how can they protect themselves. And if anything happens, as you mentioned, we do end-to-end solutions. We help them recover both technically, their data if they have a data breach, or we even help in reaching access to insurance, cybersecurity insurance, in case that they have losses because of an unintended data breach. One of the things that we need to remember is that HIPAA compliance, it is not only about training, it is not only about certification, it is also about what has the company done in order to actually make HIPAA, the implementation of HIPAA measures effective. One thing we always say, great, we have a HIPAA statement, but what happened with when was the last time you trained your employees? When was the last time that it was verified? Or simply, when was the last time that you verified that the data that you're sharing in the cloud is automatically protected. Is it encrypted? Is it protected? So all of that is part of HIPAA compliance, and that's where HIPAA focuses so much, not only on companies saying that it's compliant, but also what measures you have actually taken to meet the need of the security need of patient data.
Right. Yeah. And in terms of training the workforce on HIPAA compliance, it has to happen at least annually. And is the training that you provide for the workforce, staff at a healthcare organization, customized for that organization's workflow, or is it standardized?
The first training we provide is standardized for companies in the healthcare system. We have training that is specifically for HIPAA, and we can work with some of the clients that have more specific needs to provide them with a more detailed training targeted for their very specific needs. The reason we like to provide both is because one of the main challenges is that many companies, and we have seen it right now with the crisis that we're facing, the amount of data that is coming in and the regulations changing are incredible. We have companies in which we're bringing employees on a regular basis, hospitals and nurses and healthcare providers actually work in many different facilities. And we need to be able to deploy training that is immediate. You hire a new personnel, you cannot wait 3 months until we have a customized training. You need to be able to send them to a training. You need to be able to track that they take the training, which is something we do and we provide to our clients. And you need to be able to realize that they're certified and keep track that, yeah, within my organization, they became certified on HIPAA. We know that healthcare professionals are certified, but every organization where they work still needs to do their training and keep track of it. And that's one of the things we provide.
Yeah, that's the weakest link usually with HIPAA compliance is the human error. Employees, the workforce not doing what they're supposed to be doing. Yeah, subjecting themselves to those phishing attempts and etc. Yeah, so when data is breached, you say you help recover that data. Can you help explain the basics of how that is done? Because most of us would think, hey, if the data is breached, if the data is in the hands of an unauthorized individual or entity, how would you ever get it back? Once it's out there, it's out there.
Well, the first thing to realize is you are 100% correct. Once the data is out there, it's out there. There's not much you can do. But there are things you can do on a proactive basis. One of the most important components of HIPAA compliance is, do you encrypt your data? And when you encrypt your data, do you have the ability, which is what many people don't realize, do you have the ability to manage that data even when it's outside your control? AKA, if you have encryption and somebody gets a hold of that data, or let's say you have an employee that have left the organization, and I'm not talking about somebody trying to do something bad, but simply on today's day and age, we all work out of our laptops, our cell phones, our tablets. Do you have the ability to control that data and manage that data once it is outside the limits of your organization? Let's say the person retired, and let's look for all the good options. A person retired at the end of their career, but they might have data on their cell phones and laptops. Can you take that access away? Can you take that data? And if you have your data encrypted and you manage encryption keys, yes, you can use simply unauthorize that person, and that automatically reduces the ability of that person to actually access the data. They might have bits and bytes on their computer, but without an encryption key, they won't be able to read it. So that's how we say we protect it even on that event when you implement a complete solution.
Right. Yeah. Yeah. Doing utilizing encryption so you can claim, safe harbor with devices, and when people have access to hard drives with data, but when it's full disk encrypted, there's no actual breach. There's an incident, but no breach because it hasn't been accessed. Yeah. So another piece of, HIPAA compliance is it's very much an administrative task. Policies and procedures, training, business associate agreements, etc. But another piece of it that most people do not know how to do effectively is to conduct a risk analysis of the technology that they're utilizing, and then create a risk management plan for that technology to mitigate that risk. Because most people don't know what to look for in terms of risks to using particular technology. So is that something that you assist with?
That is one of our areas of expertise, and definitely an area where CySeSo excels. And that's what we mentioned from the beginning, that we have partnered with some of the leading companies in the field of cybersecurity to provide access to the latest technologies. The primary challenge, as you clearly identified, is that for many companies, it's hard to comply from the technical standpoint with HIPAA because the number of regulations. From our case, what we're doing using the partnerships that we have, we can give what we call, HIPAA compliance on a click. There is a series of, depending on your needs, both from a virtual standpoint as well as from an office standpoint, we can deploy HIPAA compliant specifications on a click. And to give you an example, we have a series of established commands that if we're working with you, we can say, okay, if you install this software, which is our compliance management protocol, we automatically can click and say, okay, you're a HIPAA organization, and we will implement all the rules that are designed to protect the information. Anything from encryption, from data leak protection, to remote control of devices if we need to. So we do it on that way. Trying to do all this on a manual way, one person at a time, it is extremely challenging and difficult.
Yeah.
And that's what we have solved on that way.
Yeah. So you use a management system to manage devices, browsers, users, and you just push those policies onto those devices and track and log those devices and track incidences and make sure that they are using the current updates and etc. Yeah, that's a must.
Yeah, we not only track it, we actually give clients access to see what's happening on their network, and they will receive copies of it. We receive the first copy and we automatically execute. The challenge is, for example, with some of the incidents and some of the challenges, is that really by the time you receive the email saying there is a breach, the incident has been identified, has been actually isolated, the node has been isolated if possible, and we actually have remedied it all the way to, and of course we do it on a very controlled environment. We don't do this with customer data, but we can show how, even in the case of, for example, ransomware, the ransomware attack is stopped, the files are restored to their previous state, and the node is isolated even before the email saying we have an incident has had the time enough to leave the mail server. When the software is installed on the client PC, this is taken care of automatically. Yeah,
and with a lot of remote work right now, with clinicians working from home, you can not easily, but you can use a program to manage their devices and their user accounts. What about their networks, right? So their internet, using their router and making sure that they're actually securing those and not providing others access, etc. How do you handle that?
And that's exactly what we said. And I will repeat myself, but it's what we do. And that's why we provide the best of breed solutions. And we have solutions that are first on industry, actually using Fortinet, to name one of the names of companies we use, that automatically will protect your network. It's the same thing. We can do it from an end user standpoint, from a device standpoint, or we can do it from a network standpoint. And when we do it, by the way, regardless of how we do it, it's an end-to-end solution. For companies and for providers, for example, healthcare providers that are completely virtual, we have a software-only solution that takes care of it. Healthcare providers that have offices, as the majority of them do, we have a combined solution of hardware in the offices plus software components at the end user devices. And all of them actually help them protect from end to end, both their offices and their devices. In addition to that, we have an umbrella component, which is what we call disaster recovery, in which we can help companies manage their actual data on their servers and websites and recover the service in case that anything happens. Usually in about 15 to 30 minutes, they could have their servers virtually online recover, while if anything happened to the network. And I'm not even talking about something that might happen from a hacker standpoint. Let's say there is an accident, there is a flood, there is anything like that. We could have their servers backed up to the last point of recovery and back up online in minutes.
Yeah. And do you conduct penetration tests, for the individuals' networks and technology that they're using to spot vulnerabilities?
That's part of what we do. We conduct regular tests primarily of their websites. If we have If we're managing the networks, usually our systems will automatically let us know. And to give you an idea, the policies on the systems get updated from the provider's labs usually multiple times a day. So if there is an attack, we already know even before somebody identifies a node. But yeah, we do monitor the public information, usually on the websites, and we can conduct penetration tests on demand from the companies if they so desire. If we start seeing activity that we're not aware of it, we will conduct a penetration test.
Oh, okay, yeah. And then so yeah, it's clear that you help set up technology for an organization that's going to provide good security and allow them to be HIPAA compliant when using that. Healthcare organizations also partner with other technology that they don't have control over, and they have to make the decision as to whether or not to use that technology. And part of that process is to conduct a risk analysis of someone else's technology that they're going to be utilizing. Do you assist with that?
Yes, we can assist with that. And you mentioned one of the biggest challenges that are today in the field of healthcare, which is IoT. IoT sounds great. By the way, I love the technology, but the problem is that many IoT devices are not built with security in mind. That was not part of the industry. It is catching up right now, but it's still not part of the initial developments. And we all have seen, and have heard about breaches on IoT devices that have affected not only one device, but the network. That's one of the challenges that we have. And again, going back to when we're taking a look at the network, yes, we have as part of our solutions, we not only can conduct and make recommendations on what it is known about those IoT devices based on the security briefs that we get, but also we can help secure those IoT devices. And the reality is, as we all can imagine, although we cannot go to each one of those devices because we do not own them, or the company does not own the device, what we can do is we can isolate, we can create a network that will isolate. If one device is penetrated and we see a device doing something that is not expected on the network, we will automatically isolate that network, regardless if it's a hardware connection or if it's a wireless connection. We can isolate each device individually. So even if an internet criminal, a hacker, is able to breach into one device and say, the hospitals, we have somebody visiting the hospital and they are able to breach into one device, as soon as that device tries to do something that is not expected, it will be isolated from the network and they will receive an alarm saying, go ahead and check this device, there is something wrong on it, replace it. Because we also understand that that device could actually be the vital link to somebody providing a service. That's an immediate danger that is a red alert that we need to communicate, not only from an IT standpoint, but from a healthcare life standpoint, to let people know that, hey, this device might be in use. Go and visit this patient, replace the device, there is something wrong.
Yeah, yeah. And, when I think about our listeners listening to this right now, so if you're listening to this, you might be a very small practice. You might be a large organization that has your own IT team, your own compliancy officers, or you might be a large healthcare organization where you do have your own compliancy officers and IT team. However, you need an outside consultant for verification of your security or to help you with an incident. So Jorge, I'm wondering, with your company, what's your clientele like? Because with the with the extent of the services that you provide, I would think that I'm thinking, is it too expensive for a really small practice? And a large healthcare system might already have it in place. So where do your clientele or customers lie?
Okay, the majority of our customers actually lie on the side of small to medium, from individual practitioners to medium healthcare organizations. And the way we work exactly as you described. We are a trusted provider. We are coached when needed. And we actually work with their existing organizations. One of the things I want to be sure that we explain to people, as you rightly said, cybersecurity, and the way I look at it is just exactly like, I like to relate it a lot to actually the healthcare business. We're on the business of protecting the health of the networks and the network information, so we're very related. You can look at cybersecurity primarily as preventive medicine. That's what we try to do, prevent the networks and the individuals from getting sick. And asset recovery when need to. We can do major surgery, we can replace equipment if needed. But as it happens in medicine, that's not our objective. We work with the organizations, with our clients, and with their current service providers. Many companies that are on IT are very good at what they do on IT, and we partner with them to provide the cybersecurity component. Because as it happens in many other fields, cybersecurity is a very specific field, and that's what we focus. So we work with, with individual providers and their IT service providers to be able that we provide the support that we need. We're not trying to replace their IT teams. We're trying to augment them with the knowledge, anything from compliance, anything from training, anything from audit management, anything from cybersecurity equipment and measures if we need to, but working in conjunction with the people that work already with their computers, with the network, and with their network IoT devices that are their practices.
Yeah, and I would imagine that at times with your customers, the access that you get from your customers, that at times you may get access to PHI. So do you provide a HIPAA business associate to your customers?
In this case, what we try to do is we try not to access PHI. That's why we remain only on the cybersecurity portion of it. We're trying to be very careful, and as I was mentioned before, that's one of the reasons we don't do demos on customer sites. If they want to see a demo, we actually offer them demos, but we do it on our networks to show them what the capabilities are, because for HIPAA, we do everything we can not to access that data. It is one of the things that is paramount on our practice.
Right, yeah, but the fact that you may have access to PHI, do you provide a HIPAA business associate agreement to your customers?
Yes, we do provide the agreement to them. And I remember what I said at the beginning. I have received information, and automatically I do what I need to do, which is I inform them that I have received them. And I let them know that, hey, this has happened. Please be sure that we address this one. So yeah, we do it. It's just that it's something we try to keep very clear and very separated. And that's what I mentioned. Yeah, we have received that information. It happens because we're on the list of communication. Yeah.
Yeah. And what about evaluating the security of mobile devices, like what are they, monitoring devices for patients and those kind of things, and the transmission of the data for monitoring devices or mobile devices to the to the EHR?
You mentioned one of the most important things that is happening with the field of telemedicine right now, and primarily in the last few months, considering the crisis that we're facing, in which many providers turn on to telemedicine to be able to meet the needs of their patients. The primary challenge, which you identify very correctly right now, is that while providers themselves are business professionals and they are at least trying to do the best they can in their offices, we're accessing customers using customer networks, using customer devices at customer sites that have not been hardened for. So what we do is, although we cannot control, what a customer might or might not do, what we can do is we can make sets of recommendations, and we can help those customers and the providers harden all the way to their end user sites if necessary. If the clients are willing and able to either implement hardware on the residences, which is our primary recommendation, because on that case it's automatically, then we can be sure that we can encrypt all the data from the patient side all the way to the provider side. In many cases, we are accessing, we're doing telemedicine, accessing customer data. So what we do is we implement our intelligent and intrusion detection systems. So even if you're just communicating over an unsecure line to the patient, we can analyze the connection and we can inform you if that connection somehow it is being intercepted from the source to the destination. Anytime we see something happening on the encryption, anytime we see something happening with a payload, for example, you can ask a client to, can you send me this data? We will analyze the data transmitted, look at the file and the payload coming in, and if we see that it's not something that we expect, either because the patient sent something by mistake or the patient computer itself might be infected, we can give you a heads up and let you know that some of that data coming in, it has been isolated because it carried a virus, it carried a phishing attack that we're not blaming the end user, but his or her computer or device might be infected. And that's why we look at it and implement securities at either one of the ends to protect you.
Excellent. Yeah, and what are maybe a couple things that most organizations usually are missing? That one of the couple, maybe two of the top things that you've noticed when you're working with organizations that they've missed that need to be addressed for cybersecurity.
The two things that I have seen mostly missed, and we kind of touched on one of them, is that many organizations lack the ability to control the devices after they lay the network. And what I mean with this one is we all do business from our cell phones, from our laptops. What happened when an employee leaves the network, and I'm not meaning leaving the company, when he goes home and his kid or somebody opens a laptop because they want to do something, and they might put a virus. It might be his personal laptop he's using to access emails at the company. But if you cannot manage that one, you're putting your organization at risk. That's one of them. The second one is everybody's moving to the cloud. The cloud is great, but many organizations are not aware that the cloud service provider, the responsibility on the cloud service provider for security is a shared responsibility model, which means that they will be sure that if anything happens on their networks and on their hardware, they take care of it. But anything that is related to your specific data, it is your specific responsibility. If your account gets hacked, it is not the network's responsibility, it is yours. And that's something that people don't understand. They will be responsible if the network gets hacked. But if somebody breaks into your password because your XYZ cloud was not sufficiently secure or your data is not encrypted, it is your responsibility, and HIPAA will hold you accountable for it. And those are the two biggest dangers that I see, because many companies think I move to the cloud, I'm using very reliable companies, Google, Microsoft, Amazon, which they are the greatest companies and they're awesome, but they use a shared responsibility model because of that reason. Because your data is your responsibility.
Yeah. Do you think some of those password management programs are trustworthy? Secure is what I mean. Not necessarily not trustworthy, but secure if used properly.
Yes, I do recommend all customers to use a password management application. But what we recommend is use password management applications that can be managed from a central site. And that's exactly, remember what we said. If we can manage your access to the passwords and to the encryption,
that's right.
You don't have access to the data after you leave. So yeah.
That's right. Yeah, the administrator needs to have full management, access, control over all of those services of the workforce. Yeah, it's a great point. Excellent. So, listening to this great interview with awesome information, if you're an organization from small to large and you need support for cybersecurity, you can visit CySeSo's website and get the information that you need. You can reach out to them to the contact form where they will contact you and follow up with you with whatever needs it is that you have. Excellent. Yeah, so thank you very much, Jorge. I greatly appreciate it.
Raymond, I want to thank you. I want to thank Telehealth for the opportunity to share some of my experiences with the clients. And anything we can do to help your clients, we'll be more than welcome to do it. And please, regardless of, and I will be very short, regardless of what you do and who you go with, be sure that we all understand that we are in this together. We are in this to help you meet your HIPAA compliance needs. We also in this one to help you being able to deliver the care that our patients in every more of these challenging days that we are facing.
Excellent. Thanks a lot.
You're welcome. Thank you.